That begs the question, are we discharging too early? Are we not giving them enough exposures within the clinic or within a more athletic setting, and kind of throwing them out there a little too early? And then to kind of follow up on that, Matt, if you could, were any of these kids in the study part of a continued training program or anything after the fact that was led by you or by themselves? Was that possibly a indicator of return to performance?
Yeah, that's a great question. We do track these kids over time. To my knowledge, and I would have to kind of dig into these data a little bit. I'm not really aware of any that participated in kind of specific, second injury prevention type activities or training. Most have a kind of gradual transition back to sport, and we see them over time. And they, generally speaking, kind of like we saw in the study, either are able to successfully resume, they decrease their sports participation over time, or they have an additional injury. But I think it's a really important question that, what these athletes engage in outside of, practice and games and the testing that we do may have an impact. And we don't really know what that is. And that, I think, is one of the inherent limitations of an observational study. We try to collect as much data as we can, but we can't really comment on causality here, only association. But I think it's a really great question. Going back to your first question, which was about, are we releasing them or clearing them too early? I think this is a really important discussion. So, we saw that at least in this cohort, most of them are getting cleared on average. Again, this is just an average, but on average at about 8 months. We know from some longitudinal work and research from the Oslo Delaware cohort, which the first author on this paper is Hedgie Grindum. It's published in the British Journal of Sports Medicine. They looked at how time to return to sport was associated with risk of second injury over time, as well as what factors were related to this. And they found that there was, for the first 9 months, every month that was delayed, there was a reduction in risk until 9 months. And that strength was a factor that was related to reducing second injury risk. So I think that time plays a role, but I think we need to be careful and not just evaluating time. So I think that there are biological considerations from a graft integration, kind of what we might kind of call like a joint homeostasis perspective. We have this injury to the joint, we have surgery, we have a graft placed in the joint that's healing either, with bone patellar tendon bone grafts, bone to bone healing, or you have these plugs placed in this hamstring graft. But, that's not a ligament. And so we have this process of kind of ligamentization over time. Mm-hmm. And what factor does that play? These patients have an effusion in their knee. Obviously, we know about the impairments like strength and other things. So all of this is, all of these factors are kind of interplaying together over time. And it takes time. So it takes focused intervention, but there is still a time component. So I think we need both. But I think where we're trying to get away from is just making that decision based on time. And so there have been several systematic reviews over time that have shown that when we look at what factors are used to clear patients for return to sport after ACL reconstruction, far and away, time is used most often. By far, and then we see these other objective measures. So I think just evaluating and testing even these basic measures and having some level of comparison to norms or to the uninvolved limb is better than the majority of work that we've seen published, and probably to some degree a lot of what we see in clinical practice standard of care. So again, I think time is a factor, as is strength and movement and knee-related function, as is psychological readiness. and a lot of other things that we're not measuring too.
Yeah, there's another paper that when I was digging into all your stuff earlier, and you used LSI and you used the hop tests as your objective measures for clearance, and then obviously time was in there. And of the people who had been cleared, I think it was 13.9% of the people who had clearance had actually gotten past those two strength tests and the hop tests.
Yeah.
And that was a startling number for me, to think that, 87% of people didn't pass a lot of objective measures before kind of taking that leap back into sport. And it does point to time being obviously the biggest factor. People go, oh, well, you're 9 months out, then go ahead, do your thing. But if you're not prepared, which is preparation is one of the things we talk about on here a lot, are you really ready?
Yeah. So that was a study that was also published in JOSPT a couple of years ago. Allison Toole is the first author on that paper.
Yeah, I think it's 2017 or 2015, something like that.
2017, yeah. We were curious to see kind of, a similar question, but to see, we know what are, at least kind of generally speaking, return to sport criterion that are at least recommended, which what we evaluated in that study were, how many have a patient-reported, function score above 90 out of 100, how many have limb symmetry indices for hop test and strength above 90%. We looked at those all individually and then all combined.
And that was quad and hamstring too.
Yeah, quad and hamstring. And so what we saw was, like you mentioned, only 13 or 14% of, I think, about 120 young athletes in our cohort met all of them, even though they were, again, on average about 8 months out. So I think it really does speak to time is a factor from a biological and a healing standpoint, but time isn't going to ensure that these patients, are able to restore adequate strength and function. And so again, I think it speaks to, again, because we don't in this cohort control any of the rehab or return to sport decision making, it really is kind of a snapshot of what is current clinical practice and decision making. And I think that finding, just like you said, it was kind of startling to us too, to see that. And that's been replicated or shown in a couple of similar studies since, which have found somewhere in that neighborhood, basically 15% or less of these cohorts of patients that have been cleared after ACL reconstruction are meeting even these standard thresholds or benchmarks that we have kind of established. Not even taking into consideration the fact that, as we talk about in the paper we're discussing today, some of the issues with limb symmetry indices and how the uninvolved limb might get negatively affected as a part of the injury or rehab or detraining or being out of sport or whatever that might be. Even when we don't consider that, we just look at limb symmetry indices, very few patients are getting to these thresholds.
Mm-hmm. We talked with Mike Raymond a little bit about that. It was a lot of these studies aren't using the return to sport battery of tests. They're using time as the main criterion, and then that's that piece of the puzzle. And then the other piece of the puzzle is that when we are using those battery of tests, not everybody's passing them, and they're still getting cleared. So you have this kind of twofold issue here. Was one reason why I liked your paper so much here, because at least we know that all the participants got the same tests